I get a lot of questions about whether hormone replacement therapy is the right choice for someone. So if you're wondering if it's right for you, let's jump into some info together. Hi, I'm Dr. Jenny Wax. I'm a family physician and a certified menopause specialist, certified through the Menopause Society. And my goal right now, a huge passion, is to help women make good choices in midlife about menopause treatment. A lot of people ask, what is hormone replacement? And so really hormone replacement is when, a woman has gone through surgical menopause, their ovaries removed when they're young, and we're replacing the hormones that they should be having in their 20s or 30s. But menopause hormone treatment is giving enough estrogen and often progesterone to help smooth out the symptoms of the perimenopause time. And so specifically the menopause treatment with hormones, we start with estrogen, and estrogen is available in all different forms. There's several different formulations, and then it can come as a pill that you take orally. And most typically what I prescribe is topical estrogen. And this can come in a patch. It's a little tiny sticker really that you put on your belly, gel, or a spray. And then often if someone does have a uterus, we need to also give them progesterone. And then there are other hormones, formulations that are used for other issues like vaginal estrogen, which I could talk about in a different video. But the reason why someone would go on hormone replacement or menopause treatment, would they choose estrogen? Why would they need this? So really, estrogen deficiency will feel like the hot flashes, the night sweats, the trouble sleeping, irritability, mood swings, joint pain. When someone's telling me about that, all of those symptoms, it makes me think that it's an estrogen issue, and they're going to feel so much better if we can give them back some of the estrogen that's heading down in perimenopause and menopause. Beyond just symptom control, we know that women who take estrogen will have a reduced risk of osteoporosis, will help maintain their bone density if they can be on estrogen in the first decade after menopause, so in late 40s into their 50s. So those are the benefits. Of course, with any medicine, I always tell my patients about risks, and we talk about that for sure. One of the big risks with estrogen is increased risk of blood clots. And so actually giving someone estrogen topically, so that's the patch or the gel or the spray, eliminates the risk of blood clot. So that's usually what I start people on. Very few people don't get relief from that, and they might need to take the oral estrogen, but most women do great on topical estrogen. And then there's a lot of controversy, and the old studies that made everyone scared of hormones discuss increased risk of breast cancer. And what we know is that estrogen doesn't actually cause breast cancer, but if there's a breast cancer already present that is an estrogen receptor positive breast cancer, so then that's something we look for when diagnosing a breast cancer, then taking estrogen might help that estrogen receptor positive breast cancer grow. So what I do is I make sure women are up to date on all of their mammograms and breast cancer screening, and then as long as they're up to date and there's no personal history of breast cancer, then we can go ahead and use estrogen. So that's why it's really important to have a thorough intake, a thorough consultation that we can review risk. So those are the main risks. And then it's just really important for me to see women and have a good long consult so we can figure out what treatment is going to be the best for them. And based on them and their medical history, their family history, their life. I have some women, I'll talk about a patch and they're like, that won't work for me because the patch has to be changed twice a week. And they're never going to remember. But they say, if you give me something I have to do every day, I'll remember. And so even that small conversation to figure out what's going to actually work, how someone's actually going to be able to be successful with taking a medication is really important. And then after I start medication or hormones with someone, we follow up usually every month until we figure out a regimen that's working well for them. Often in the beginning, we have to make some adjustments up or down just to get the exact mix that's going to work well for people. If you are thinking that you might have symptoms of perimenopause and menopause and you want to discuss getting treatment, I encourage you to reach out for a consultation. You can do that through my website, or if you're far from me and you're not in one of the states where I am licensed, then look for a Menopause Society certified provider to help you. I think that's really important. And then also see below, I have created a menopause guide that just has more information. So feel free to download that.